Hi and Assalamualaikum to Safi and everyone. I'm Nushaira. Want to present about abnormal psychology. Abnormal psychology is the branch of psychology that studies unusual patterns of behavior, emotion, and thought, which may or may not be understood as precipitating a mental disorder. Although much behavior could be considered as abnormal, this branch of psychology generally deals with behavior in a clinical context. Abnormal technically just means different from the norm. Abnormal psychologists focus on whether or not a person's thoughts and behavior cause distress and social problems. Some abnormal psychological conditions can cause irrational or harmful behavior either to self or to others. One of the parts of abnormal psychology is depression. Depression is a common and serious mental illness that negatively affects how you feel, the way you think, and how you act. Fortunately, it is also treatable. Depression causes feelings of sadness and or a loss of interest in activities or enjoy. It can lead to a variety of emotional and physical problems that can decrease a person's ability to function at work and at home. There are a lot of signs of depression, but you may not have them all. How intense they are and how long they last are different of person to person. Some of the ways you might feel are sad, empty, or anxious. It will continue over time without getting better or going away. Helpless, worthless, or guilty. You may feel bad about yourself or your life or think a lot of lose or failures. Hopeless. You may be pessimistic or believe that nothing good will ever happen. You may even think about suicide. Irritable. You may get restless or more cranky than usual. There are many things that can cause the depression. Some of it is family history. Depression can run in families and some people will be at an increased genetic risk. However, having a parent or close relative with depression doesn't mean you will automatically have the same experience. Personality. Some people may be more at risk of depression because of their personality, particularly if they have a tendency to worry a lot, have low self-esteem, are perfectionists, are sensitive to personal criticism, or are self-critical and negative. Serious medical illness. The stress and worry of coping with a serious illness can lead to depression, especially if you're dealing with long-term management and or chronic pain. Interesting fact of depression is drug and alcohol use. Drug and alcohol use can both lead to and result from depression. Many people with depression also have drug and alcohol problems. Over 500,000 Australians will experience depression and a substance use disorder at the same time at some point in their life. Exercise helps manage depression. Exercise improves mood state. Dr. House says. He explains that exercise helps stimulate natural compounds in the body and can make you feel better, and for at least 30 minutes of physical activity most days. Dr. House also says, we typically recommend that people with depression exercise, develop a healthy diet, and go to bed at a regular time. Depression is a leading cause of disability. The World Health Organization considers depression to be a leading cause of disability worldwide. People routinely say that depression is the worst thing that's happened to them, and the reason that's offered is that their brains don't work properly. They can make decisions and they aren't sure of themselves. Interesting issue of depression is there are many famous people suffer from depression. One of them is Jovan Belcher, 25 years old, the linebacker for American football team Kansas City Chiefs, shot his girlfriend first before committing suicide. He fired 9 shots at his girlfriend, leaving her 3-month-old daughter without a mother. The same day, he met with the coach and general manager of the club and shot himself in front of them, leaving his daughter without any parent. His last words were, I wasn't able to get enough help. Chris Benoit, 14 years old. Chris Benoit to the kill wife and commit suicide to another level. After strangling his wife, the WWE superstar also strangled his 7-year-old son and then killed himself. The medical reports show that he was battling dementia and suffered from severe brain damage. Virginia Woolf, 59 years old, another popular novelist and author, Woolf also suffered from mental health problems. She has battled mental health problems several times in her life, but at the end she had no strength to go through the process again. Her suicide note described her feelings the best. I feel certain that I'm going back again. I feel we can't go through another of those terrible times, and I can't recover this time. I begin to heal once. She filled her pockets with stones and walked into the river where she drowned herself. The issue affects the depression and field of psychology. In brief, depression, even the most severe case, it is highly treatable disorder. Once diagnosed, a person with depression will be given a treatment. The most common treatment are medication and psychotherapy. Many studies show that cognitive behavioral psychotherapy is highly effective. More than drug therapy, psychotherapy addresses the thinking patterns that precipitate depression. And studies show that it prevents recurrence. Drug therapy is often helpful in relieving symptoms such as severe anxiety so that people can engage in meaningful psychotherapy.
I'm Kausaliya, going to talk about bipolar disorder. Bipolar disorder, also known as manic depression. It is a chronically involving mood that swings between the highs of mania and the lows of depression. Depression is by far the most pervasive feature of the illness, while the manic phase usually involves a mix of irritability, anger, and depression, with or without euphoria. Mood swings of extreme happiness or sadness are normal for most people, not just for those with bipolar symptoms. There are few symptoms of bipolar disorder: feeling extremely happy, talking faster than is normal, feeling agitated, overconfidence, decreased sleep, irritability, racing thoughts, behaving impulsively, engaging in high-risk behaviors such as reckless driving, gambling, or excessive spending. The causes of bipolar disorders are: life events including various types of childhood trauma are thought to play a role. Biological factors probably create vulnerability to the disorder, and experiences such as sleep deprivation can kick off manic episodes. While genetics play a big part in people who get bipolar disorder, it's not always inherited. Interesting fact about bipolar disorders are: bipolar disorder can occur in children as young as age 6. It is more likely to affect children of parents who have bipolar disorder. People with bipolar disorder are more likely to experience problems with the use of alcohol or other drugs, but the drugs do not cause the disorder. People living with bipolar disorder are unreliable, untrustworthy, and unemployable. Interesting issues. Jane Pauley, a television journalist, began experiencing depression at the age of 50 and wrote it in her autobiography. Pauley suffered from hives, and it is thought that steroids used to treat the condition kick-started manic periods. Pauley explains that without mood-stabilizing medications, antidepressants can be dangerous, producing a bungee cord effect. Secondly, Catherine Zeta-Jones. She has bipolar disorder type 2, a form that has longer down periods following a difficult time in her personal life. Zeta-Jones went through a period of mood swings following an intense period of stress. Zeta-Jones has been public about being bipolar and has been an advocate for destigmatizing mental illness, hoping she can inspire people to seek treatment. Thirdly, Linda Hamilton. She struggled with depression most of her life and was a compulsive eater. She counts from the age of 20 to 40 as her lost years until she was diagnosed as bipolar in the 1990s. After diagnosis and treatment, she told AP Radio, "My quality of life is more amazing than I ever could have imagined in those 20 years of struggling with illness." The issue affects the bipolar disorder and field of psychology. There are many things that psychology does to help a person with bipolar disorder. Some of them, psychologists will suggest a mood stabilizer drugs for a bipolar disorder person that are typically prescribed to prevent the mood swings. Next, psychology also gives bipolar disorder psychotherapy. Psychotherapy teaching them self-management skills which help them keep their everyday ups and downs from becoming full-blown episodes. Lastly, psychology also found that the treatment for bipolar disorder in children and teens may include medication and family-based therapy. Living with bipolar disorder.
Living with bipolar disorder. It's like having good days and bad days, except it happens all the time. Sometimes I can hardly wake myself up. And the dumbest things frustrate me. I ignore people who are important to me. Sometimes I throw out my meds, and I go nuts. It's so damn hard. But sometimes I have the good days, and I learn to appreciate them a little more. And I want to go out and be normal for once. Because, in the end, I'm just like everybody else. I can still relate. I can still love. I'm still a person. And I still matter.
Hi, my name is Tejshri. I am going to explain about personality disorder. The definition of the personality disorder is personality is the way of thinking, feeling and behaving that makes a person different from other people. An individual's personality is influenced by experience, environment and inherited characteristics. A personality disorder is a way of thinking, feeling and behaving that divides from the expectation of the culture, causes distress or problems functioning and lasts over time. Personality disorder is divided into 9 types. Firstly, paranoid personality disorder. Individual affected by paranoid personality disorder have a general suspicion that everyone is out of mystic system. Schizoid personality disorder. This condition turns to cause persons to avoid social interaction and be indifferent to social cues. Antisocial personality disorder. People with antisocial personality disorder have a noted disregard for the rights and feelings of others. Number 4 is borderline personality disorder. Borderline personality disorder causes patients to have unstable emotions and mood swings. Number 5 is tyrannical personality disorder. This condition is characterized by acting in an overly dramatic or emotional way, usually as a way to draw attention. Number 6, narcissistic personality disorder. Named for a figure from Greek mythology, narcissistic personality disorder causes patients to have an inflated view of self or their importance, often at the expense of others. Avoidant personality disorder. People with avoidant personality disorder are often extremely shy and above feeling of inadequacy. The other one, dependent personality disorder. People who have dependent personality disorder have difficulty functionally without the height of encouragement of others. Obsessive compulsive personality disorder. The condition is characterized primarily by a compulsion to engage repetitive behaviors and repetitive thought patterns. Okay. Next is symptoms. Symptoms the emotions of symptoms of personality disorder vary between disorders and express themselves to varying degrees with each person. For example, people with avoidant personality disorder have an extreme aversions of conflict, allowing others to take advantage of them. Physical personality disorders affect the mind, but they can drive people to neglect their physical health as well. For example, someone affected by schizoid personality disorder may neglect personal hygiene or suffer from insomnia due to fearful thoughts, while a person who is obsessive compulsive personality disorder may have rough skin for excessive washing. The next one is causes. Genetics. Some studies of twins and families suggest that personality disorders may be inherited or strongly associated with other mental health disorders among family members. Environment. This involves the surroundings you grew up in, events that occurred, and relationship with family members and others. Stressful childhood. May people with the disorder report being sexually or physically abused or neglected during childhood. Some people have lost or were separated from a parent or close caregiver when they were young or old. Parents or caregivers being substance misuse or other mental health issues. Interesting fact. Animals have distinctive personalities. Does it ever seem like your beloved pet has a personality that makes him utterly unique? Animal researchers have found animals from their every species of animals, from spiders to birds to elephants, have their own personalities which prevents behavior and quick that persists throughout life. While some critics suggest that is responsive anthropomorphism or ascribing human traits to animals, personality researchers have been able to identify consistent behavioral patterns that can be empirically measured and tested. Interesting issues. Emotionally intelligence predict peer rated social competence above and your beyond personality traits. The other one, original article determinants of personality in the scope of motivation for maintaining abstinence in the case of male alcohol dependent individuals concluding therapy. The results of numerous studies indicate strong associations of personality with the occurrence and also with the treatment of alcohol dependence. However, there is no agreement regarding the role of particular dimension of treatment. The issues affect the personality disorder and field of psychology. There are many things that psychology to do help personality disorder. Some of that is psychology have made some research about personality disorder. The research have studied about the cause, symptoms, treatment, and also have to control the disease. Psychology also studied about the different type of personality disorder. All of these is very helpful for personality disorder person. Psychology also gives treatment such as dialectically behavior therapy, schema therapy, transference focus psychotherapy, and also a mood stabilizer to a personality disorder patient. As a result, all of the treatment can be help the patient to reduce their disease. Thank you.
Hi, I'm Fatimah Azzahra. Next, I want to talk about schizophrenia. Schizophrenia is a disabling, chronic and severe mental illness that affects more than 21 million people around the world. Symptoms include hearing internal voice, having false belief, disorganized thought and behavior, being emotionally flat, lack of motivation, having delusion and hallucination. These symptoms may leave a person feeling fearful and withdrawal. Their disorganized behavior can be perceived as incomprehensible or frightening to others. People with schizophrenia may not make sense when they talk. They may sit for hours without moving or talking, or may seem like they are talking to themselves.
Some of the symptoms of schizophrenia is firstly hallucinating. They see, hear, smell or feel that no one else can see, smell or feel. Voices are the most common type of hallucination in schizophrenia. Secondly, delusion. Delusion is a false belief that is not part of the person's culture. People with schizophrenia can have delusion that seem desire, such as believing that neighbor can control their behavior with magnetic wave. Thirdly, thought disorder. It is unusual of dysfunctional ways of thinking. One from a thought disorder is called disorganized thinking. Thinking have disorganized their thought or some connecting them logically. They also talk in a confusing way that is hard to understand. The causes of schizophrenia. First, gene and environment. We inherit our gene from both parents. Scientists believe several genes are associated with an increased risk of schizophrenia, but that no genes cause the disease by itself. In fact, recent research has found that people with schizophrenia tend to have higher rates of rare genetic mutation. This genetic difference involves hundreds of different genes and probably disrupt brain development. Secondly, different brain chemistry and structure. Scientists think that an imbalance in the complex, interrelated chemical reaction of the brain involving the neurotransmitter dopamine and glutamate, and possibly others, play a role in schizophrenia. Also, the brain of people with schizophrenia looks slightly different than those of healthy people. For example, fluid-filled cavities at the center of the brain called ventricle are larger in some people with schizophrenia. Thirdly, drug use. Research has suggested that taking drugs during the teen years and young adulthood can increase the risk of schizophrenia. A growing body of evidence indicates that smoking marijuana increases the risk of experiencing psychosis. The younger and more frequent the use, the greater the risk of having a psychotic episode. The interesting fact of schizophrenia. First, some schizophrenia can tickle themselves. Mentally sane people can predict the sensory consequence of their own action and reduce them, whereas schizophrenia has trouble recognizing their own action and often attribute their behavior to an alien source. Secondly, people who smoke cigarettes at a young age are up to 80% more likely to develop schizophrenia later in life. Thirdly, schizophrenia is diagnosed in more men than women, with a male to female ratio 1.4 to 1. Fourthly, left-handed individuals tend to have schizophrenia more than the right-handed individual. Interesting issue of schizophrenia. Firstly, Deputy Health Minister Datuk Sri Hilmi Yahya said each of the 100 nations were diagnosed with mental illness schizophrenia. Secondly, 1.1% of the worldwide population that been diagnosed with schizophrenia is over the age of 18. Thirdly, there are a lot of famous people that suffered from schizophrenia. Some of them are Edward Einstein. He is a son of Albert Einstein and his first wife Mileva married. He actually was extremely intelligent and a successful student throughout his education. He also wanted to be a psychoanalyst, but by the age of 20, he was begin showing the sign of schizophrenia. He was hospitalized several times throughout his life. He died in an asylum at the age of 25 years old. Secondly, Mary Todd Lincoln. She is a wife of American sixth President Abraham Lincoln and also the First Lady of the United States. She being diagnosed after her youngest son, Willie, died at the age of 7 years old. Many historians and psychoanalysts also speculate that Mary suffered from bipolar disorder. Exactly 11 years after her youngest son died, she became unconscious and died the next morning because of stroke at the age of 64 years old. Thirdly, Vincent van Gogh. He is a famous painter and artist. Actually, he never been diagnosed, but many historians believe that Vincent van Gogh suffered from schizophrenia because there are many different stories of his behavior, make some scholars think he had schizophrenia. Other psychiatrists also think he might have depression or bipolar disorder instead. He committed suicide in the age of 37 years old. The issue affects the schizophrenia and field of psychology. Psychology helps schizophrenia person by giving them an individual psychotherapy. Individual psychotherapy involves regularly scheduled talks between the patient and psychologist. The session may focus on current or past problems, experience, thoughts, feelings, or relationship. A positive relationship with a therapist gives the patient a reliable source of information, sympathy, encouragement, and hope, all of which are essential for managing the disease. The psychologist therapist can help patients better understand and adjust to living with schizophrenia by educating them about the cause, symptoms, or problems they may be having, so they can be more easily to live a better life.
Schizophrenia simulation.
It follows you.
Where is it?
Silence.
No. No pills for me.
No more pills. Destroy them.
It weakens us.
He is here. So go.
Stupid.
You're a waste of my time.
He poisoned it. Drink it. Hide now! It's close.
Hi, I'm Puteri Aliah. I'm going to talk about obsessive-compulsive disorder, OCD. Definition of OCD is a mental disorder in which people have unwanted and repeated thoughts, feelings, ideas, sensation, and behavior that drive them to do something over and over. Often, the person carries out the behavior to reduce the impact or get rid of the obsessive thoughts, but this only brings temporary relief. Not performing the obsessive ritual can cause great anxiety. A person's level of OCD can be anywhere from mild to severe, but if left untreated, it can limit his or her ability to function at work or school, or even to lead a comfortable existence at home or around others. Although OCD symptoms typically develop during the teen years or early adulthood, research shows that at least 1/3 of adult cases begin in childhood. The causes of OCD is often accompanied by depressions, eating disorder, substance abuse, a personality disorder, attention deficit disorder, or another of the anxiety disorder. Coexisting disorder can make OCD more difficult both to diagnose and to treat. Secondly, there are also theories that link OCD to the interaction between behavior and the environment, which are not incompatible with biological explanations. Thirdly, some research point to the likelihood that OCD sufferers will have a family member with OCD or with one of the other disorder in the OCD spectrum. In 2001, a meta-analytic review reported that a person with OCD is 4 times more likely to have another family member with OCD than a person who does not have the disorder. The symptom of OCD is have repeated thoughts, image, and urge about diverse issues, including being compulsive need and organized fear games, deaths, and contamination. Includes all of violent or imagine hurting loved one or committing sexual acts, or behaving in a way that conflict with religious belief. Secondly, Spend at least an hour a day on the thoughts and ritual which cause distress and get in the way of daily life. Thirdly, have obsessions that are intrusive and compulsions that often feel out of the person's control but detected by a rule that must be applied rigidly. The interesting fact of OCD is OCD can start at any age. In 1/3 of adult patients, the symptoms begin in the childhood, adolescent, or young adulthood. Secondly, persons having OCD often cleverly hide their OCD successful from family and friends. Thirdly, few OCD patients respond to placebos in contrast to 30 to 40% of depressed patients. The interesting issue of OCD is the untreated symptoms may vary for years. The symptoms may go away, remain the same, or worsen. Evidence suggests the OCD runs in some families and may be genetically inherited. Secondly, with OCD, the thoughts and rituals cause distress and get in the way of your daily life. Thirdly, a mental health professional who specializes with anxiety disorder should be able to help you assess whether or not you have social anxiety disorder in addition to OCD. The issue affects the OCD and field of psychology. A person suffering from OCD will need to go through withdrawal by not doing rituals. Hence, therapy is the treatment of choice to break the circle of OCD, much like detox is necessary to break the circle of addiction. Also, as with chemical dependence, depending on the unique case, OCD withdrawal can be either a cool turkey process or a more gradual tapering of the ritual. In the conclusion, mental illness such as depression, bipolar disorder, personality disorder and schizophrenia, and obsessive-compulsive disorder OCD is a part of abnormal psychology. People have always wanted to know how and why people behave in certain ways. At the same time, gone by, the explanation for such behavior has changed and advanced. Understanding the way mental illness and abnormal behavior affect a person and why has become very scientific, and there are advancements each time a new study is conducted. Thank you.